Hi, this is John O with Doc Affinity. Thank you for visiting us on YouTube. This educational video discusses the impact of healthcare reform on health insurance. Let's begin by talking about what's often referred to as the individual mandate. This is the heart and soul of healthcare reform, and the part that was upheld by the Supreme Court last year. The law requires most Americans to have health insurance. This is a big deal. In New York State, for example, 16% of the population does not have coverage today. Businesses are also affected by the law. There is no requirement per se, but companies with 50 or more employees can face significant penalties, so it's almost like a requirement. Good news for small businesses, there is no requirement and there are no penalties. Furthermore, healthcare reform offers new opportunities. We will discuss some of these opportunities later in this presentation. So what happens if you disregard the individual mandate? Well, there are financial penalties that begin in 2014 and increase in later years. For example, an average size household with $100,000 in income would initially be subject to a $1,000 penalty. 2 years later, the penalty increases to $2,500. These penalties are assessed by the IRS during tax time. We won't go too deep into the penalties for businesses. However, for large businesses, the basic penalty for not providing group coverage is $2,000 per employee after the first 30 employees. As mentioned already, there is no requirement or penalties for small businesses. However, if a small business does not have group coverage, then the owners and all the employees must either carry individual policies or be covered through their spouse's insurance. With healthcare reform, small employers without group coverage have three options. The first option is for the employer to do nothing. Just let the employees figure it out for themselves. Some will end up paying the penalty, while others end up purchasing insurance through the Health Benefit Exchange. We discuss the Health Benefit Exchange in the next slide. The second option is for the employer to help their employees purchase individual health insurance. Typically, you as the employer would buy this navigation service from a qualified broker. While this isn't group coverage, it would be considered an employee benefit. The third option is to actually offer group coverage. With the Health Benefit Exchange, key restrictions no longer apply. For example, the employer can pay little or nothing toward the premiums. There's also no minimum number of employees that must participate in the health plan. For businesses that already have group coverage, we have a separate video that discusses health insurance strategies. Please check it out. The individual mandate, the requirement that most Americans have health insurance, would not be practical unless there was an easy way for millions of people to buy coverage. That's where the Health Benefit Exchange comes into the picture. An exchange is a central marketplace where health insurers offer products that meet certain standards, and it's easier for buyers to comparison shop. With healthcare reform, the law requires each state to either build or run its own exchange or have the federal government do it for them. New York chose the former path and will launch its own exchange on October 1 of this year. We absolutely believe that the Health Benefit Exchange is a better way for individuals and businesses to buy insurance. Number one, prices should be lower. This is especially true for individual coverage. In the past, only people that needed insurance purchased it. With the individual mandate, we've got more people and a healthier population in the risk pool, which leads to the lower prices. The same principle applies to businesses, although to a lesser degree. Number two, we partially addressed this in the previous slide. There's no minimum employer contribution and no participation requirement. Furthermore, healthcare reform disallows exclusions for pre-existing conditions as well as lifetime limits on benefits. Number 3 and 4. We discussed these topics in detail in our video entitled Impact on Health Insurance Part 2. But for small businesses, these two attributes are big pluses. In essence, they allow the broker and the employer to develop a thoughtful and more cost-effective health plan. The Health Benefit Exchange will make the New York health insurance market more competitive. Currently, Oxford Health Plans is the dominant player with about 80% market share in small groups. The marketplace used to be much more competitive, but right now there's very little choice out there. However, the Health Benefit Exchange is like a reset button. It's an opportunity for some insurers to get back into the market. More competition is a good thing for buyers. Lastly, the topic of tax credits and subsidies is not something we're going to explore deeply today. Tax incentives are available to both individuals and small businesses. One point to highlight is that the Health Benefit Exchange is the only place that administers the tax credits and subsidies. Please refer to the Doc Affinity website for additional information, or feel free to contact us. We're well qualified to discuss tax matters. Thanks a lot for your attention, and please consider leaving a comment. We appreciate the feedback. And as a reminder, there is a second part to this video. In it, we focus in on the advantages of the Health Benefit Exchange.